Hi, my name is Shane. I'm going to be talking about anti-vaccination campaigns today. More specifically, I'm going to be talking about how anti-vaccination campaigns negatively impact the health of future generations of Americans. I'm going to do that by demonstrating that anti-vaccine campaigns are misleading to parents, and it causes them to believe that vaccines are ineffective or cause harm. Because anti-vaccine campaigns advocate that people should refuse to get vaccines, and because parents who refuse to get their child vaccinated are needlessly putting their child's life in danger. So my first point, like I said, was that anti-vaccine campaigns are misleading parents into believing that vaccines are ineffective or cause harm. In regards to vaccines being ineffective, I researched studies involving infection rates of pertussis among European countries with both high and low vaccination coverage. Those countries with high vaccination administration rates were 10 to 100 times more effective at minimizing infection compared to countries with low administration rates. This shows that without vaccine, infection rates will continue to grow. In regards to vaccines causing harm, contrary to what campaigners say, there's never been any data to suggest that vaccination rates have a causal relationship with autism in children. This misconception was born due to a speculative correlation between autism in children and MMR vaccination rates, which is measles, mumps, and rubella vaccination, between 1980 and 1994. When tested in a research environment, the data suggested that there was no correlation between children vaccinated with the MMR vaccine and autism. It should be noted that according to Reuters, quote, after a close review of more than 1,000 research studies, a federal panel of experts has concluded that vaccines cause very few side effects and found no evidence that vaccines cause autism or type 1 diabetes. My second point is that anti-vaccination campaigns advocate that people should refuse to get vaccines. This can give new life to diseases we once thought were dead. Two diseases we often hear about in contemporary media are whooping cough and measles. Two diseases which were once well under control due to the widespread use of vaccination and which are to this day very preventable. The current outbreak of measles in New York City has infected nearly 3 times as many people as it had in 2009, even though the US government declared the disease eradicated in 2000. When people aren't vaccinated from birth, they can become infected via travelers from outside the country, which is a danger to their life. My third point was that parents who refuse to get their children vaccinated are needlessly putting their child's life in danger. In 2006, even though both the number of cases and deaths of pertussis in the US had dropped by 99% since the pre-vaccine era, there were still 27 deaths that could have easily been prevented by a simple shot. According to the CDC, the current incidence of whooping cough outbreak is tied to vaccine denial, and that unacceptably low numbers of people are getting vaccinated across the board. Anti-vaccination campaigns giving misinformation to parents, such as the myth that vaccines cause autism in children, cause distrust of the vaccination implementation system set up to prevent deadly diseases from spreading and leads to unvaccinated children. The CDC concluded that 80% of the cases of measles in 2013 were in children who had never been vaccinated against the disease, and that 80% of the group claimed that they did not get vaccinated due to philosophical differences. In conclusion, the anti-vaccination movement in America is creating pockets of people who are prone to infection of contagious diseases by spreading misinformation regarding potential harms of vaccination and advocating the refusal of vaccination services, which leads to unnecessary harm in children. Thank you.
Well, you labeled the proposition, but at the beginning, because you used the word how in front of it, it makes it sound like an informative speech. I'm going to explain how this has had this particular effect instead of making the claim, this is having this particular effect. I know it sounds like a subtle difference, but it is a difference. The secondary issues are previewed for us pretty well. I thought that you did a subtle job on that. You didn't use numerical signposts on them, but it was clear if you're listening closely. Remember, sometimes audiences aren't listening closely. They might need a little bit more help, but I didn't think it was problematic, just something that maybe could be a little bit better. In the body of the speech, though, the signposting is very clear and easy to follow. On each of the points, you've got a good explanation of your ideas on those particular points, and usually there's some information that follows up on that. I was a little surprised on the second point how thin the information was, connecting the lack of vaccines with the outbreaks, and then it turns out that all that information is actually on the third point. So I think some of it needed to migrate up in that second point so that we could see that that's where that relationship is. On the first point, we need some data that says that it's the campaign. You mentioned that there are these campaigns that they're out there, that they're influencing people. There's barely any reference to it. There's certainly no data that refers to it. At the end of the speech, you mentioned that the CDC, I think it was the CDC, in reporting on people who have not gotten vaccinated, most of them indicate that they have philosophical differences. That's, I guess, as close as we get to any explanation about what this campaign is, except your assertion that some people are reacting to the MMR vaccination study that has been discredited. And I think that's probably part of the case, but I think you need to offer some proof on it instead of just taking it as a presupposition. The data on vaccination rates was pretty clear at the beginning. You did have also an explanation or a criticism of that MMR study. I thought you had a good quote that dealt with the federal panel reviewing that study, so that was effective. The CDC gets mentioned in a couple of places. Like I said, it seemed to me like the data on that third point probably fit better with some of the things that you're talking about on the second point. The other thing that concerns me a little bit is that if you pursue it this way, it does feel a little bit like you're trying to back somebody into taking the position that these folks are right, and I don't know that anybody feels like that is the case. If there are other explanations on this, if there's a controversy about this that's based on some reason or some information, I think that we need to know a little bit more what that controversy is. Otherwise, it's kind of like this pseudo notion that Jenny McCarthy and her acolytes have all created a campaign to keep people from getting vaccinated, and that's a big presupposition. And I think they're the person responding to this is really just going to have to look at other reasons that people don't get vaccinated that have nothing to do with any anti-vaccine campaigns. That's kind of the weak link in your argument. All right, thank you.